today I am with Dr. Amy Spoelstra. Dr. Amy, welcome. So excited to have you here.
Thank you, thank you, thank you. Always a pleasure to do anything with you. So thank you for having me.
I'm very excited for this. And for those not familiar with the incredible impact that Dr. Amy has within chiropractic and within the health and lives of patients and the community, Dr. Amy opened a Spoelstra family practice in April of 2008 after moving from South Carolina, where she graduated cum laude from Sherman College of Chiropractic. She and her family love to travel and experience new cultures, and her favorite things are exploring new places with her family, learning about different cultures and people, yoga, a good cup of coffee, and to study. And I mean, seriously, she is an epic learner and is going to bring some incredible knowledge and insight and wisdom. She's also the founder of the Focus program and Neurodeflective Retraining Method, Focus educational seminars for chiropractors, Focus Academy, and the Brain Blossom program. She opened the Focus program within her practice in 2011 and has been helping children and adults with neurodevelopmental disorders in the Northwest area ever since. She's the founder of Focus Educational Services, where she trains and consults other doctors around the country and here in Australia. We'll talk about that in a moment in the Focus model and how to lead with brain development to make the case for chiropractic. In fact, this is what I really want to share before we get into this incredible keynote is that Dr. Amy will be bringing Focus accreditation to Australia through the Transponder Research Foundation at Dynamic Growth Essentials in Brisbane. Dr. Amy will be sharing how to become the authority in helping families struggling with neurodeflective disorders. And this 2-day event will include 16 formal learning hours so you can obtain Part 1 of your Focus certification. And this training is highly sought after and will not be returned to Australia for some time. So make sure you're registered. Contact the Transponder Research Foundation for more details or go to the ASRF Facebook page where the event outline and links to the program are. And so this is going to be incredible. Before we talk more about that at the end, though, Dr. Amy is also the co-founder of Navigate Your Healing, which is an online platform designed to help parents and families who are affected by autism spectrum disorder or ASD and other neurodevelopmental disorders, and to navigate this overwhelming situation in what can feel like an isolating world. And now, bring you breakthrough in practice and life, Dr. Amy Spoelstra.
Thank you so much. I'm blushing. It kind of like sums up my really nerdy life, in all those words. And the studying part, yes, that is absolutely true. It's my favorite thing to do. I love learning. We all have those times where maybe we're like getting down or we're feeling like kind of less energetic. And one of the things that I notice, my husband actually tells me if I'm starting to feel like sluggish or not as energetic or motivated. He tells me like, I think you might need to just go spend some time studying. That's always what like gets you going again. And it's true. And I think that's what has really been my driving factor through my whole life. I was born in a family with a brother who struggled and a dad who was a neurooptometrist, and a mom was an educator. And I've just been really all about learning, and really my biggest, I think, passion is finding simplicity on the far side of complexity and like some really complex topics. And then I fell in love with chiropractic. And then I went, wow, this is the foundation of helping people. An efficiently communicating, functioning nervous system is the foundation that is missing in so many when we're talking about mental health challenges, behavioral learning, socialization challenges, chronic stress response. And I started to put these pieces together in my own life and my own clinical practice. And one of the biggest challenges that I see in our profession, and have experienced also in my own clinical practice and experience, is that there's a lot of complexity in working in this world of behavioral learning, socialization challenges, or what I call deflected developmental processes. When we're talking about things like autism or ADD, sensory processing disorder, dyslexia, anxiety, these types of things. There's just a lot. There's a lot of different methods. There's a lot of different approaches. There's a lot of different people saying a lot of different things. And these and families are complex. And there's all of this going on. But what we know is that when we find the simplicity on the far side of complexity, whether we're looking at it from a chiropractic standpoint or outside of chiropractic, we can see that the foundation must be the health and the state of the autonomic nervous system has to be looked at first. And other professions are really starting to get on board with that. They're starting to look at the brain. They're, whether we're looking at educators or neurooptometrists or psychologists, they're saying, hey, what's the state of the nervous system first with a child who's struggling? And then we can build upon that. And that's why I'm so passionate about getting chiropractors understanding how to find the simplicity on the far side of complexity, to learn to lead with the brain, to make the case for chiropractic, because this is our domain. This is what we do. We are the doctors and the experts of the nervous system. And we have to be able to find the simplicity, have simplified clinical understanding first, and then process and procedures that's congruent with that understanding, that's congruent with our philosophy, science, and art. And when we can do that, when we can find the simplicity on that through what I teach is these hierarchies of brain development. We learn about the hierarchies of brain development. What do they mean in typical and deflected development for kids and all ages? This information is really for all ages. When we can learn that, the typical trajectory first, and then we can learn what does an altered neurological nervous system and communication and function within the nervous system do to impact that trajectory of development. And we can simply understand that first, and then we can know what to look for on our exams in looking for subluxation and the impact of subluxation on that developmental trajectory of the brain, and then how that can lead to these behavioral learning socialization challenges. When we can do that simply and stay congruent by doing that, we get to not have this chiropractic dilemma of trying to chase the symptoms or treat the disorders or treat the kids or treat the ADHD or the reading challenges, which is what gets us in hot water in the pediatric realm and in all realms. But when we can do that, we can understand how to approach the whole person, hold apart, lead with correcting subluxation, and have a seat at the table with communicating and collaborating with parents, with families, educators, with providers of all different types. And so it becomes not about this game we've played in chiropractic forever, which is it's us versus all of them. When we can lead with the brain and simply make the case very intelligently and simply for the nervous system being unaltered and efficient, it makes it easy to have a seat at the table, to be able to be not about us versus them, the patient and or all the other providers, but really be the foundation or be the quarterback of the team. And it's amazing when we can do that. It takes us out of this place of, one, trying to be the things that we're not, and two, trying to just be insecure in what our place is in this realm, in this domain. And one of the things we're going to talk about a lot in this seminar as well, we're going to find the we're going to simplify the clinical integration and understanding and learn the hierarchies of development, learn how to apply that simply into your exam, things to include in your exam, specifically what to do in your exam, specifically what that means, how to care plan from that. What does this mean? How to do re-exams and know, hey, when might it be time in addition to your care? What would you look for to know in addition to what you're doing by correcting subluxation? Maybe it's important to work with an optometrist or do primitive reflex integration, or, whether you do it in your practice or you work with someone else, but it doesn't replace the chiropractic. And the chiropractor doesn't have to become these other things. You get to be the expert in what you are, what we are, and stay congruent with what we do and make the case for the families and for the other providers and really help this population that is emerging. Like, this is what we were going to talk about, the stress that these children and these families are under now and how that's impacting development and how individuals are making decisions, how they're learning new information, how they're developing, how they're processing, what their mental health state is. You have to understand the state of the people in your community from a neurological perspective in order to have a practice that can appropriately communicate to the people in your community. And you have to know that the massive amounts of behavioral learning socialization challenges that are impacting families now is different than pre-pandemic. That's something we're going to talk about. We can't ignore it. We can't ignore these challenges. We can't say, I don't want to know about that. One of the things I've heard in my time doing this work, which has been a long time, almost 16 years, is that chiropractors will say, well, I have a family practice, but I don't really want to work with kids with behavioral learning socialization challenges. I just want to work with like kids that don't have those challenges. And my answer to that now is one, you are already working with those kids. You just may not know it. They may not have a diagnosis. It may not be something big and obvious. And we're going to talk about that, how to exactly spot that and see what's going on and be able to help build the bridge of understanding for the families and the parents without saying there's something wrong with that kid, right? There's nothing wrong. It's a window into their neurological expression. We need to understand it, be able to communicate it, understand the parent processing and learning, and then have very specific protocols and systems to be able to integrate that child into your practice and under your care to help them have a better expression of life. That's really, really important. And so that's the first thing is you can't just if you work with kids at all, if you work with people at all, you're working with people that are impacted by chronic stress and they're having deflective processing. It's already there. It's happening. This is the world we live in now. And the other thing is that even if you don't work with kids and you don't want to work with kids at all, the stress response of even adults now post-pandemic is impacting us neurologically, everybody. It is impacting our mental health status. It is impacting the way we connect and have relationships and perform our jobs and show up in our families. And so we have to know more about how to lead with the brain. These people are in your practice. We cannot put our head in the sand and pretend that it's not there. We have to know a bit more about it, but we can do that in a congruent way that doesn't lead us away from chiropractic. This is what we're gonna dig into and find simplicity on in the clinical integration part of the seminar. The other piece is we have to be able to have very practical implementation strategies for, hey, what do we do with systems in our office? How do we, train our staff on understanding what we're doing and how chiropractic impacts, the developing brain? How do we communicate effectively with a parent in stress who's having decision fatigue? What is decision fatigue? What is stress neurology? How's the best way to market and communicate and a care plan and have retention for families that are living in chronic stress and have neurological response as a result of that? That's different now than it was pre-pandemic. And we were already going down that road and now it's much worse. So we have to be able to know these things, and it applies to every age, in every practice, every human being, including us. And so this is what we're going to talk about. Two main things. We're going to break down finding simplicity in our clinical understanding to make the case for chiropractic, to stay congruent with chiropractic, but to be able to lead with the brain. And two, practical implementation, understanding stress neurology, understanding what that means for our systems, marketing, communication, just basic practice systems and knowledge, and specifically how to work with implementation, with working with families who are dealing with behavioral learning, socialization challenges, because that is a massive amount of people who are looking for help in our communities now. And we have to understand who they are, what they're looking for, and how we can best communicate to them, because it is different. What we do isn't different, but how we communicate is different and should be different now than it was before the pandemic. So that's what we're going to be really breaking down over 2 days. The certification series for the Focus Academy, we have, I think, around 180 certified chiropractors and some OTs and some medical doctors around the world in 6 different countries now. A lot of them are offering the Brain Blossom program, which is a program that you can offer once you get certified. What we're doing here in February in Brisbane is we're offering part 1 of a 2-part certification series, but it's going to give you, even if you just take part 1, you're going to have a ton of information, and you're going to have developed a brain-based lens. You're going to have a lot of simple implementable things to do right now to help take us away from the kind of the hot water that we get in chiropractic when it comes to pediatrics, which is because we don't necessarily know how to communicate and understand ourselves and then what to put on our exams and re-exams. What we do in the pediatric population, we can say, hey, what we don't do is treat these things. But then if we don't really know how to say, but this is what we do, and this is how we know that we're doing that, and we have confidence and certainty in that, what happens is if we don't know how to do that second part, We can say the first part, this is what we don't do, but then your actions are not matching that. And we get in hot water because we look like we're treating ear infections or treating colic or treating ADHD, but we're not treating anything. We have to be able to go beyond this is what we don't do. We have to understand what we do and be able to communicate that and simply integrate that into our practices. And that's really what this focus work is all about. Developing a brain-based lens to help the people that really, really are desperate for help now. And the results that we get, as we all know, are incredible. But there are some very unique challenges to working with and understanding development, neurological processing, deflected development, and stress neurology. And that's what this is all about. I'm really excited to continue to expand our reach with this work to help more chiropractors make the case for chiropractic and really help more people, certainly, but increase utilization of chiropractic as chiropractic, not all these other things, but chiropractic.
You know what? This is so important, so profound, and so valuable. And I know the impact that you have within your practice and that the practitioners learning, the focus model have as well. I want to, before we talk a little bit more about focus program, I want people to have an understanding of what is taking place within the practice, because you alluded to we're already seeing these children we may not necessarily recognize it. So can you begin by saying what that spectrum looks like from those potentially, what we would consider, I guess, normal, where you go, these are the normal kids coming in who do still have some evidence of neurodeflective disorder taking place, to the plethora of types of presentation from autism and attention deficit hyperactive disorder. So what are we looking at when we're talking about neurodegenerative or neurodevelopmental processes in children, and the labels that they come in with that are not appropriate or necessary? What
Yeah.
does it look like? Who are we seeing?
Yeah. And that's one of the things we're going to go over a lot of specific cases to help people see like, oh, that I have that kid in my practice and I see that child in my practice. But think about this. Typically, when people think of neurodevelopmental disorders or neurodeflective disorders, they think of things like, I ask this often when I'm teaching, I say, what do you think of? And people say autism, right? And I say, well, what do you think of when you think of autism? And they usually have a really intimidating presentation in their mind about maybe stimming, a self-injurious behavior, maybe nonverbal communication, these things that are like, in chiropractors, we all have big hearts, right? I want to help that child. I know that child would be helped, but I don't know how to, one, explain what it is that I do necessarily so that the parent really understands it beyond like a surface level, right? And something that's going to build retention, right? So that you can get the amount of care that you may need to help that child, right? And practical strategies on how do you even connect with that child to be able to perform your exam and adjustment, right? Because of the sensory defensiveness and these types of things. So that's what people often think of. And they're like, I'm really intimidated by that. Or the super hyperactive, impulsive child who's, like messing up the waiting room and, they're thinking of their typical practice and they're thinking this would be just a problem if these kids came in. Now, of course, there's that. That's a presentation that we can see and we probably all seen. And unfortunately, we're having more and more children that are more and more impacted. And yeah, we do see a lot of bigger presentations. However, there's a lot of kids that it might be just the looks socially inappropriate, looks rude. The teenager, this is a really common presentation, who looks rude. Hey, every time they come in, I talk to them, I say hi, they never make eye contact, they barely respond, they mumble, they just are rude. This is a rude child. Often there are underlying reasons that that child is having trouble with central vision, with connection, with being able to engage in a way, with executive function and visual cognition, to be able to have appropriate, like, what did you do today? Beyond, I don't know, be able to, parents say this all the time. What did you do today? I don't know. And they're frustrated. Well, there might be a reason. They might just be a child saying, I don't want to talk to my parents, but also there may be a reason they're having trouble with retention or grabbing something visually in their visual imagery from the past and being able to express that. So behaviors or challenges are a window to the brain. You may have a child who comes in and messes with your table every time and they're really impulsive and and you're like, gosh, they always mess with my face paper. And this is just an annoying kid who has parents who aren't setting, boundaries, and there's discipline issues and it's the parent. Well, actually, maybe there are challenges with that child being able to see multi-step instructions to go from the waiting room to the adjusting table to face down. Multi-steps seen into the future. It may be a 12-year-old where you would think they should have this, but there could be a very specific reason, and likely is that that child is having trouble. And we're going to learn why that is and how to spot that. You may see the child who's this is a great one, who is perfectly, perfect posture, very rigid, absolutely gets A's, is perfect. And when they go home, they explode. They have anxiety or they have explosive anger. And the parents are like, yeah, they're perfect everywhere else. Teacher says they're perfect. They're great when they come into your office. But man, do we have challenges at home. There's a reason for that. This is a child who's not just being a bad child. There is a neurological underpinning that at play here, gaps in development that are leading to deflected processing. And we need to understand that. And then we need to be able to spot it through conversation, through observation. And then we need to be able to simply make the case for the parents to understand what it is that we can do to, one, determine what might be going on there by what I call asking and answering two big questions on our exam, which you're going to learn exactly how to do. What are those two questions and what do you look for to help understand why that child might be having explosive anger but perfect behavior everywhere else, or impulsive behavior everywhere they go, or whatever it may be. We have to be able to ask and answer two questions, but bridge that gap for parents, and then be able to monitor change beyond, do we just see the symptom change? We need to be able to know what we would be looking for and what might be appropriate to expect for that child. So there's a lot of different examples. The other thing that often I get people say, well, I don't want to do that. I just want to work with typically developing children or babies and toddlers and things like that. And here's the thing. If we want to work with typically developing children, we need to support typical development. In order to support typical development, we need to be able to know what typical development is beyond just milestones. And when we can understand more about the developmental hierarchies of the brain, and we can say, hey, I'm watching and supporting typical development, we can see what I call these like smoldering little fires before they become forest fires, right? Huge fires, huge symptoms, huge challenges. And we can help support and correct those potential deflections before they become, a diagnosable condition or a big challenge. That's our role. The same information is so critically important when we're supporting just healthy families. That's what we're about, right? We are supporting healthy families develop. We need to know how to see things before they're big things so we can support those healthy families develop. And in order to do that, we have to be able to find the simplicity in our understanding. Lead with the brain.
Incredible. Bear with me for a second, Dr. Amy, because I'm going to try to bring a paragraph that encapsulates everything I've just understood from what you've said. So if you as a chiropractor already have clients, practice members, patients in practice, or you would like to see more children, more families, and have more families under care, and find what is interfering with the expression of their health, and healthy families keep healthy families well, and even find that there are families that are out of balance and bring in and restore them, there is a chiropractic model that the focus program is going to deliver that will help you meet them where they're at, lead them where they need to go. And where they may be at could be anywhere from experiencing birth stress, life stress. They may have come in seemingly just simply disorganized by life. They may have some level of anxiety. They may have levels of depression. They could have emotional and behavioral learning difficulties. They could have challenges with socialization, or they could have overt neurodevelopmental symptoms where they are experiencing autism, or behavioral challenges that are outbursts of behavior. They could be evidencing significant challenges, including being nonverbal or not being able to express themselves. So there is a wide spectrum and gamut of children in our practices and in our communities that need to be supported and understood where they're at, and to be led on a journey of healing and repair and removal of interference so that they can express their health in their lives, and we can create family unity. And that's what the focus program allows us to do, is to look into that entire continuum with a sense of understanding of being able to realize where they're at, address the challenges that are there, and then provide strategies to move them in the direction of a better life through better neurological integrity and therefore expression of better health. Is that close?
Nailed it.
All right.
Perfect.
I have one other question then, if that understanding is correct. And I know there'll be chiropractors that say, look, I know that the area of neuroscience is broad and the scope is immense. And, I don't want to have to do a neurology diplomat because that's so intense, so demanding. And you've spoken about the far side of complexity with simplicity, but it can't simply be that easy because this is a complex area. The brain, I did neurology at university and that was my toughest subject. And how do I begin this journey and what can I possibly cover in a weekend that will give me confidence, certainty, belief, and the capacity to know that I can identify the challenges that are before me and have clinical acumen to be able to confidently make change? Is it really possible in a weekend, and how so?
Yes. So I think that this has been we all have our challenges, our childhood challenges and our gifts that have been given to us because of that. And because I grew up in a very intellectual family where I was the kid in the back of lecture halls at neurology conferences and neurooptometric conferences and really learned neurology and neurodevelopment from a really inappropriately young age. I think that's the gift that I was always seeking, like, okay, so how do I make that understandable to myself, to my 6-year-old self, to my 25-year-old self, to my early provider self? Like, how does this all make sense? And so one of the things that it's really the foundation of everything that I do and have done clinically in my practice, and then eventually said, okay, I'll teach this. I had no intention of teaching this ever, but I ended up getting bullied into it, so I did. But yeah, so wait, pra really bullied into it, but I love it, so that's fine. And so it's really all about we start with the 30,000-foot view of, "Hey, let's understand this." And so I have a lot of neurodiplomats who come in and they go, "That's really simple at first," but it helps me put it together. I learn all this complex stuff, but now I have this framework, a lot of them in the Focus Academy, Brain Boston providers that are neurodiplomats and they know more, tracks and they've got more even than I have, but they're missing this piece of how to put the pieces together and how to know how do I put this together and how do I keep chiropractic in this? And so because of my background in, neurooptometry, I've brought that into the chiropractic and married this and said, okay, I need to have a 30,000-foot view understanding and I need to be able to implement this stuff. And the way to do that is to have a system. And so we start with the whole and then we pull down the parts. And so whether you already come with this deep level of neuro understanding or whether it's like, what's that again? It's fine. We have a system. You learn the system, you learn the concepts and then the system and you arrive at the results and then you can keep learning. It's a whole to part model as opposed to how education is, which is backwards, which is part to whole. That doesn't make sense. We memorize all these little things and then we go, okay, how do we fit it together? Instead, and that's what this whole curriculum is about, which is why you can walk away with really practical stuff and then continue your learning journey, which is the fun part, right? We start with the whole and say, here's the 30,000-foot view. Here's the systems. And then in level 2, we keep pulling down the pieces and pulling down the pieces. And I have doctors that have been with me for years and we're still pulling down the pieces. I'm still learning. That's why it's fun to continue to learn, because we have a framework of which to apply the parts that we learn and continue to develop, but not neglect the whole person, the whole concept. And so you really can, the whole entire curriculum is built on, we start here and we build down, which is why if you stop in the middle with like a one weekend, you still have a lot to do in clinical practice and a lot of really practical stuff. And then most people go, I want to keep learning because this is fun. And then you can do that. That's great.
It's amazing. And I think the beauty is the impact that you have, the lives that you change, the miracles that you see make it entirely worthwhile. And
Yes.
I think that
Yeah.
learning is an imperative and is why it's so exciting to be able to bring an incredible international expert to Australia for the Australian Spinal Research Foundation and make this groundbreaking information available so that we can change more lives. And for that, we are incredibly grateful, Dr. Amy. We always appreciate you so much and to extend that to you coming here to teach and to bring this knowledge is so amazing for the profession, for Australia, and for the people who are going to benefit in Australia in our practice. So I want to appreciate and acknowledge you and thank you. I want to remind everybody the details are down below. The link, go to the ASRF Facebook page, involve yourself in this because you are going to see neurodeflective disorder in practice at an increasing level. And this is where you need to start harnessing your knowledge, your skills and abilities in preparation and anticipation, and then with the opportunity to make an impact on these lives. Dr. Amy, so grateful. Appreciate you so much. Everyone,
Thank you.
see you at the event.
Thank you so much. So honored.